Hi, everybody, and welcome to PAR Talks. My name is Dr. Nikel Rogers-Wood, and without further ado, I'll go ahead and get us started. So the name of this presentation, this PAR Talks, is When Does My Student Need Testing? I will be your presenter today, and my name is Dr. Nikel Rogers-Wood. In addition to being an employee here at Psychological Assessment Resources, PAR, I am also a licensed psychologist, and my professional background has been clinical work largely. So I have worked in college counseling centers, skilled nursing and assisted living facilities, and then also in private practice. And I've done a combination of therapy for things like women's emotional health, anxiety, eating disorders, adjustment, and depression, as well as a lot of psychological testing, which is how I ended up transitioning over to PAR as a project director, and in part how I am speaking to you this evening about this topic. So we've got a little bit of housekeeping before we jump into the topic at hand. So we have a copyright notice that this presentation is a proprietary product of PAR and is protected by copyright laws and international treaty. So please don't try to record, reprint, or store this presentation because it's a violation of copyright law. And in terms of disclosures for this presentation, I'm an employee here at PAR, and I don't receive royalties from any sales of PAR products. Before we start talking about the learning objectives for this evening's presentation, I actually wanted to go back for a minute and talk a little bit about how this presentation came to be. So PAR is a psychological test publisher, which means that we primarily sell to and do webinars for clinicians, psychologists, school psychologists, and other professionals who are actually doing psychological testing. However, what we've noticed is that sometimes parents call our customer support line. Actually, I say sometimes, more often than you might think. And they've got questions about testing, what it is, what to do next, how to help their student. So we started thinking, well, maybe we should do something to help parents, caregivers, faculty, staff understand a little bit more about testing since we're getting those questions. And then also, as a psychologist who did a lot of testing and a parent, I understand how confusing it can be when you see that your student is struggling, but you're really not sure what to do, what route to take, who to talk to, what is testing? Are they sending my student through a machine? Like, what is this? So we wanted to take the time to really try to take the mystery out of the testing process and help you understand what it is and some channels you might go down to get assistance if your student is struggling. So now for the learning objectives. After this presentation, you'll be able to identify 2 signs that might make a student a good candidate for testing. You'll also know more about 2 types of testing that's available for students who might be struggling academically. You'll learn about the professionals who provide testing, and you'll be able to understand a bit better potential outcomes of the testing process. Because I am, I think, hopefully speaking to non-psychologists, non-school psychologists, I wanted to start this presentation for more of a, for example, some real world examples, although they're fictional. So I'm going to give you 3 different kinds of students. Our first student is Julie. Little Julie just started 1st grade. And as her parent or caregiver, you are noticing, wait a minute, she is writing a lowercase d when she's really intending to write a lowercase b. And she's reading, but gosh, it's kind of a slow process. I'm not really sure if she's picking it up as quickly as maybe we think she should. And based on what you've read in different places, you've heard that people with dyslexia reverse their letters. And so you are going, huh, might Julie have dyslexia? Not going to answer that question, or rather apply the knowledge that you're about to learn until the end of the presentation. Let's go on to scenario 2. Evan. He's a sophomore in high school and his grades have been dropping. And you're noticing, and he is reporting to you, that it's taking him 2 to 3 hours to finish doing any of his reading. And when he checks in with his friends, it's taking them maybe an hour, hour and a half. Although he is finishing tests at school, he tells you, well, I'm not finishing during the class period. I'm able to finish because the teacher lets me stay late or come back after school to finish up. When you compare how Evan is doing now with how he's been as a student in the past, what you notice is he was a B student all through middle school and everybody thought he's a great student, no worries. But his assignments are getting harder, they're getting longer, and it's getting harder to maintain that B average. Scenario number 3 is Taylor. Taylor is a new college freshman, and they were pretty great academically all through elementary, middle, high school, A's and B's, but they've been struggling since they got to college, and this is really new and it's pretty surprising. So both Taylor and their parents are worried and thinking, we might need to move forward with some testing here. So I'm presenting these 3 scenarios to you, and we will circle back to them, I promise. And I want you to take note of what you're thinking, the guesses that you're making about what's going on with these 3 students, and what you think should happen next. And I would ask you to then, once you have learned a bit through this presentation, kind of find out if maybe your guesses or your thoughts about what should happen next, do those change? So let's talk about kind of the root cause here. What is psychological testing? So when you or a student goes through psychological testing, you are using validated, proven, trusted tools to uncover information about why somebody might be in this situation struggling in school. Psychological tests are offered in a few different formats. Sometimes they're paper and pencil, where somebody fills out questionnaires on their own under kind of the supervision of a professional. Sometimes they are paper and pencil, but you're with the professional who's administering the test. And then at other times they're on a computer. And sometimes on the computer, it's something that's supervised, and other times there's more of an interactive piece on the computer. And this, actually, the computer part, that is, has become more common since the COVID-19 pandemic, when in 2020, all of us who were doing testing had to pivot and figure out, oh my gosh, what are we going to do? Because people still need assessment services, but being face-to-face is not always a possibility. And then this next grouping is about the types of testing that are available. In general, there are 2 kinds, performance-based and self-report. So performance-based is what we think of when the professional psychologist, school psychologist, or other clinician is specifically asking questions or asking the student to do different things with tools or materials that they're given. So they're actually kind of interacting during that performance-based test. And a self-report test is more focused on, here are some questions about you. No right or wrong answers here. Just tell me more about you so that I can help you figure out the what next. Okay, so why would anybody go through psychological testing? Well, there are a whole host of reasons, and they're not all focused on academics, though the body of this presentation is mostly focused on students. Sometimes people go through testing to identify whether or not they have something called a specific learning disability. So that is the label that we use in the field of psychology, but that translates into things like dyslexia, so a reading difficulty, or dysgraphia, a writing difficulty. Sometimes we are trying to figure out if there are attention problems. So I'm sure many of you have heard about attention deficit hyperactivity disorder, so ADHD. And sometimes we're trying to figure out, are there some social emotional difficulties? So are we kind of needing to figure out if a student is struggling with something like anxiety or depression? Something that I didn't put on this slide, we also sometimes assess for developmental disorders. And so thinking about things like the autism spectrum. And something to also keep in mind is that a difficulty in one area might touch other areas. So in some of kind of my testing experience, I've seen where a client might be struggling with depression, but that affects their ability to complete homework or to study for tests. So it's affecting academics, but it might not be a specific learning, a specific learning disability. Okay, so those are different kinds, but why would a student need to undergo psychological testing? And something that I want to also, and I'll circle back to this later, is that there are a lot of different reasons why somebody might have trouble in an academic environment, or why they might be having difficulty socially or emotionally. And so sometimes testing is one response in terms of trying to help that student, but there are a whole lot of different things that we can do as well. So do want you to keep in the back of your mind that testing is not a catch-all, it is one tool that we have. So kind of back to that question about why on psychological testing, sometimes a student or child is not meeting developmental milestones, and we have questions about that. And this is something that when we look to evaluate it, there are psychological tests that we can conduct, but then we also want to do this kind of work in conjunction with pediatrician and teachers and caregivers and other people who know that child, because it is a broader picture. And that goes for when a student isn't meeting academic expectations. A test in and of itself cannot provide the answer, because we are whole people, which means what is going on at school, at home, as well as in terms of health and developmentally, all of that fits together to kind of manifest in terms of how somebody is functioning. So if a student, for example, isn't meeting academic expectations, that doesn't necessarily mean, oh my gosh, something is wrong in terms of a learning difficulty. We have to ask ourselves, well, how much is that student present in class? What's the student-teacher ratio? Are they able to interact with material outside of class in order to learn it? Because something that I talked a lot with colleagues about when I was in more academic situations is that class is a place where that information is presented, and maybe they get a little bit of practice in class, but the vast majority of that practice occurs outside of the classroom. So there could be a whole host of reasons why they might not meet academic expectations, and learning difficulties or attention difficulties and things like that are among one set of problems, but it's actually larger than that. But I'm actually going to come back to this, because all of these are the sorts of things that you as parents, caregivers, faculty, staff might be saying, well, I'm seeing some markers, and how am I going to know the difference about if it's environmental or if it's something for testing? So it's okay if you go, "Ooh, I see a flag." I'm going to help you understand some of the channels that are available to you for later. Another area where we might have questions that lead us down the path of testing are when a student is struggling in school or socially, and we just want to know, how do we help? Where's this difficulty coming from? How does it impact them? And how do we come alongside them? So a colleague of mine who is a school psychologist actually said to me, the purpose is for us to be advocates for the students. School psychologists, teachers, other staff, parents, we want to advocate for students to make sure that they get what they need, whether that's testing or something else. And so that's part of why we need to pay attention when a student's having a hard time, and then learn a little bit more about where to channel them. But there are going to be people that are helping along the way. All right, so how do I start the process? This is where it gets tricky, because we don't go from I have a concern to testing. Even when I was testing in private practice, I did not automatically test everybody who came through the door saying, I have a concern about my student. Also, the venue that you go through to start asking questions and asking for assistance, the way that it works is going to look a little bit different. So different states, different school districts, different schools are going to initiate that process differently. So I'll give you an example. I'm in Florida, and so in some of the interactions that I've had here, what will happen is that maybe during a parent-teacher conference, a teacher raises a concern, and they talk through it with the parent, and then the teacher might say, okay, I am going to make a request of guidance, and then they kind of triage that and say, okay, what is this request, and where is it coming from, and if it is an appropriate referral for a larger meeting, they have the larger meeting with the parent and the teacher, current, past, there's speech and language and all these other professionals in the school, and they kind of do a round table and kind of talk through what is it that they're seeing, do other people have concerns, and sometimes that means that they get referred over to the school psychologists for testing. And other times I say, okay, we're going to try some of these other interventions first. So that's why I say testing doesn't automatically result from having a question, but it's really important to ask that question so that you can kind of start down the road of getting assistance for your student. So for school-age children, what I typically suggest is talk with that teacher first. And the reason I say and or the school psychologist is that in some schools, the school psychologists have the ability to chat with parents, but in a lot of settings, school psychologists are so involved in the actual testing and kind of other post-testing meetings that they might not be able to meet with you as a parent or a caregiver. And so the primary teacher is really a good first step to figure out, okay, what's going on in school? Because something that's really important to note is what we see at home is not always reflected at school. So it's really good to get to collaborate with your child's teacher or your student's teacher through school age. If you've got a college student, and I know that sometimes that poses its own challenges, particularly if your student has reached the age of majority. So they are 19 years old and you can't get access without having all of these forms signed. And so sometimes we don't know who their professor is. And so if they come to you and say, oh, this isn't going so well, I'm worried about it, a lot of college students find the avenue to asking more questions, getting more information, to be through their academic advisor, the counseling center, university health services, and then sometimes faculty members, which is why when I used to be on college campuses, I often did outreach where I go to classes and talk about our services at the counseling center so that they were aware, because some counseling centers will do the testing there, or other schools do it through health services, or they have a whole referral process that is tailored for the students. And so there are a lot of different avenues, as hopefully you're starting to see, to initiating the process and getting questions answered. One other way that people often kind of start that testing process is self-referral to private practice. So what that means is I'm going to go online and find out who provides testing in my area and set up an appointment. And so that is another avenue through which I ended up seeing a lot of clients, because the majority of the testing that I was doing before I was here at PAR was through private practice. And so that's a slightly different process, because they're trying to, the student or the parent, go directly to a psychologist or school psychologist in private practice and say, okay, this is going on, do we do testing? And actually, that is our next topic. So when you start the process, and this one is kind of geared toward if you are seeking a private practice evaluation, or if you have gone through kind of all of those initial steps in the school system and are sitting down with the school psychologist who is preparing to test your student. They're going to gather information, because again, we never go straight to a standard set of tests. Things are tailored to your student, because we are going to provide an evaluation that is based on the question. And there are lots of different tools and instruments that are out there and available for use in order to kind of drill down to what's going on here. What could the trust be? So when you do an initial interview, so what we call an intake, they are going to ask questions about your student's health and developmental history, because you would not believe how much that can influence what's going on with your student, whether it's chronic medical issues or other things. Doing testing is like a puzzle. And so having all the pieces helps tremendously. We also want academic history, because if problems occurred all of a sudden, that looks different and means different things from if we had kind of a slow burn, is kind of what I say, where it just happens gradually. Then we're looking at social emotional history, and what that means is what's going on in their environment, friends, family, kind of culturally, because as I mentioned before, we are whole people, and what happens to us in one arena of life gets carried to other arenas of life and can impact us in different ways. And there'll also be some background paperwork. So there is information that will get gathered on paper and pencil, but then there are a lot of follow-up questions and more detailed questions that your clinician will ask you when they get to sit down and talk with you. So, and I alluded to this a bit before, but one of the first things that after this intake that gets thought through and discussed is to test or not to test. So just because you've gotten to the intake where you and the professional thought, yeah, it's worth having a conversation. There seems to be enough here that there is something going on. Let's talk about potentially testing. doesn't mean that they will 100% decide that testing is necessary. And though that might sometimes feel frustrating as a parent or a caregiver, I think it's really important for you to seek out good professionals and trust them and their expertise in the arena of testing. So to give you an example from my experience, there were times where people came in saying, okay, I really think that my student needs to be tested. And I said, well, let's hold off on that because this looks like more of a therapeutic concern. Would you be open to doing therapy? And there were many times when we went that route to address some of the social emotional things where that started to clear up the academic challenges that that student was having. And sometimes we might do kind of a pared down version of testing. So I won't do all of the performance-based interactive types of tests that are maybe focused on academically and cognitively or intellectually what's happening. I might say, we're going to be focusing on doing the therapy piece. And I'm not exactly sure kind of what's going on in terms of maybe we know that there's some anxiety or depression, but let's learn a little bit more about it. So I might give what I was referring back to as like self-report measures, where the student fills some things out, parents do, maybe teachers do, but we don't necessarily do the full-blown kind of full-blown psychological evaluation. That doesn't mean that we couldn't circle back to it, but it really is important to provide the kind of services and interventions that that student needs. So to test or not to test is a big question, and definitely work with your clinician about, what are we looking at here and what's the best route. If the decision is to go forward with testing, they will discuss the length of testing with you. So I have provided evaluations, or not evaluations, but testing that was as short as an hour. I've also done more lengthy evaluations where the testing took 8 to 12 hours, not all in one sitting, but overall. So it really depends on what the question is, and it's important to talk that through, and yourself if you're going to be the one getting tested or your student, and can kind of talk through how long is the student going to be able to sit and do the evaluation in a sitting so that we can schedule and kind of decide how many sessions are needed. And then the location of the testing will be determined as well. And it's really important to test in distraction-free environments in order to get a snapshot of, in a best case scenario, what does this person's functioning look like? Okay, so we have narrowed down the what, hopefully. And so who's going to do this testing? So there are a lot of different professionals who do provide testing for students who are having concerns. There are school psychologists, and a lot of school psychologists are based in schools, but there are a number of school psychologists who are also in private practice. There are general psychologists, so sometimes counseling psychologists, clinical psychologists, or just generalists will provide psychological testing. And then there are neuropsychologists, and neuropsychologists provide, although they can provide, kind of that general testing that maybe a psychologist would, very often people don't end up referred to or seeking out a neuropsychologist unless they have a more complex testing question. Perhaps they have done some testing before and there was still some question or confusion about what's really happening, or if it involves often things like concussion or other kind of health related challenges. That's when we often see neuropsychologists doing testing, but they can do all of kind of the general testing as well. And sometimes we will do interdisciplinary testing, or there might be pieces of testing that a psychologist would just say, we need more information about kind of speech formation or hearing, or how they are doing with their fine motor skills. And as a psychologist, we are not trained to do that. And so sometimes that will be a post psychological testing referral, or if we're in a setting that allows for us to collaborate in the same kind of evaluation, other professionals will kind of come in and provide their expertise on certain aspects of functioning that psychologists aren't able to evaluate. Okay, so what can I expect? This was always one that could get tricky, because often when the people who do know about something about testing or have heard about it, maybe from a friend, they might say, well, my friend's student or my friend gets extra time, or they have these accommodations. And so I'm having my student tested and I can expect these results. And something that's really important to keep in mind is that there's a hypothesis when we go into testing. We think that this is the problem. The reason we do the testing is because we don't know. And so sometimes what we get out of testing is very different from what we expected. So as an example, there have been times where I would have sworn to you we were looking at an attention problem, so ADHD. And it turned out that it was depression that was affecting that individual's ability to think and focus. At other times, we maybe thought that there was one type of specific learning disability, but when all of the results were put together and the student's context and everything was kind of merged and evaluated, turns out that yes, they were having difficulties, but it wasn't a specific learning difficulty. So really important to recognize that if you do get to the spot where you are going through the testing process, just keep in mind, or try to keep an open mind about what those results might be. Also, there's not a one size fits all. So sometimes people with similar difficulties might end up with different recommendations or different sets of accommodations. It's really important to keep in mind that people are unique, and what might work for one person doesn't work for another. And then this last bullet point here really gets back to what I was mentioning before, which is that a diagnosis is not guaranteed. Just because we go through the process of testing doesn't mean that a diagnosis is going to be the conclusion that we reach. And that is okay, because at the end of that report, that summary and that synthesis is what it's really about, helping you as a parent or caregiver, helping the student understand themselves better, understand what's going on that is causing them difficulty, and giving them some ideas for what to do next to try to improve the challenges that they're having. Okay, so even after all of this, sometimes people wonder, should I even do this? And the answer is going to be really, it depends. You have to keep in mind all that came before. Am I learning more about my student's environment as a part of that intake process where I'm having a conversation? And am I maybe determining, perhaps we go the tutoring route for a while before we circle back with testing? I think what is really important is that you're not alone when you initiate this process, that no matter what route it is that you go down to figure out how to get support for the challenges that you are having, if you are the student or if you're the parent or caregiver that your younger student is having, a big part of that is being able to collaborate with and talk with that professional about, okay, what is it that you're seeing now that you have these pieces together? Do we move forward with the testing, and why might you think that that would be helpful? That's a conversation that I used to have a lot when I was doing testing, and it's an important one because the recommendation is going to be tailored to your student. So I promised that I would circle back with our 3 students, and I want you to try to remember them and see if maybe what you think the what next might be based on who that student is. So, as a refresher, scenario 1 was Julie. She was our first grader who was engaging in some letter reversals. She was a little bit slower to master some of those reading skills, and she was still doing a lot of sounding out of her words. I've got a little more information for you about Julie. She's doing a really good job of learning her letters, both uppercase and lowercase letters. The school did some standardized testing, some pre and post, the way that they kind of typically do. So she got tested at the beginning of first grade. And the results of that testing indicate that she's on the lower end of her grade level for reading ability, but she's on her grade level. And remember, school just started a week ago for Julie. And then something else to keep in mind is that she hasn't had any outside support. So she hasn't worked with a tutor or done extra reading or writing enrichment. So, and remember, these are fictional students. And so when I look at this, something to keep in mind is the whole student. So there's still information missing from here. We don't know about her classroom or what's going on in her home environment, but we do know that reading is a developmental task, meaning that we are not born knowing how to read. It takes time. We have to learn it. And this information on this slide tells us that Julie is learning it. So she might not maybe be as fast as some of her peers, but she's getting there. And there hasn't been extra practice for Julie. So, as I mentioned before, a lot of our actual learning occurs kind of behind the scenes. So this might be a wait and see sort of scenario because she's tracking. She might have a harder time, so she might need some support, but Julie might do well with support and kind of get on with the pace that maybe the parent or caregiver was expecting to see. And something to keep in mind about developmental tasks is that there's a range. So we can't say this person needs to hit this mastery right on this day of their lives. Some will get there earlier, some will get there later, but we're looking at a range and seeing if that person is within that range. So let's go to the next one. Evan, remember him? He was our sophomore in high school. His grades were dropping. He was taking a long time to finish his assignments. He was also having trouble reading. It was taking him twice as long as his classmates, and he was really struggling to keep up. I've also got extra information for you about Evan. Sophomore year has been extra hard. And although he's a B student, he has always taken longer to finish his assignments. So the fact that it's taking him twice as long isn't actually new. It's just he was able to maintain that B average. And when he reads, he often gets to the bottom of a page and goes, oh, I couldn't tell you what I read, and has to go right back to the top and start reading again. Okay, so few things that I am thinking about as I think about, what to do with Evan. Again, we don't know a lot about what's going on in the classroom or at home or health history wise. There's a lot of information that would be good to get. But something, and this is going to vary from state to state, from school to school, but there are certain grades where the academic requirement is just a little bit more. No, I can't say a little bit more. It takes an extra oomph to kind of get there. And so some of the ones that I've seen are that first and second grade, okay, they can track, but third grade takes an extra push because it's just substantially harder. So the gap between second and third grade was bigger than the gap between first and second grade in terms of skills. And then we see that gap again between sixth and seventh grade. Seventh grade is just harder. And then in high school, we see it either between ninth and 10th grade or between 10th and 11th grade, depending on the school. And so you'll notice this kind of through the elementary, middle, and high school years. And then there's that other jump when we get to college. So that's some of it that we're looking at. But given that he has a history of taking longer with his assignments and with reading, we might want to learn a little bit more about what reading is like for him. But like I said, these are just some hypotheses based on this very little bit of information. There's a lot more that we would want to know about Evan if we were actually going through the process with him. All right, our third, Taylor. They are a new college freshman, struggling academically. As with the other two, I have additional information for you about Taylor. Taylor is living their best life in college. They found out you don't have to go to class. So they don't. They have been showing up to maybe half of the classes. And they're also figuring out that the way that maybe they could get away with not reading here or there in high school, that's harder in college because it looks like these professors are actually trying to cover a year's worth of material in a semester, and a semester is only about 15 or 16 weeks long. And then there's this other part about how even though they're struggling, they have not talked to the professor and they haven't gone to the tutoring hours that are available often for free. And when I say for free, student fees cover a student's ability to go to the tutoring center. So this is one where, again, I'd want more information about Taylor, but we can't reasonably expect the same level of kind of academic feedback in terms of grades if we aren't engaging with the material to the same level. So I would probably say to Taylor, let's try going to class, talking to your professor, and trying to figure out a routine for how you're going to address, kind of navigating and really getting into that academic material. Yes, college is about learning more about yourself, freedom and autonomy, but it's also about the academic piece. So we've got to learn how to balance this. This doesn't mean that there's anything wrong with how you are processing information or learning. It means that we're in a new environment, and this information says we haven't really kind of gotten in there and learned how to navigate being a student in college. Okay, and actually I'm going to stop here. These are the references, but I've got a really cool comment. Darlene Wheeler said, is Julie's birthday such that she's one of the younger children in her first grade? Might that affect her performance? Oh my gosh, yes. Yes, so what research says is that with developmental tasks like reading, the more time you've had to develop, the better your skills. So if Julie is a first grader whose birthday was, right before school so that she is one of the younger ones in the grade, absolutely, that could affect her performance, which is yet another reason that we might take a wait and see perspective, because it's developmental in nature here. Okay. So another question that I got was, is my advice about saying that, actually I'm going to read it so that I don't summarize it incorrectly. So I'm wondering what your advice is to parents who get outside testing and receive a diagnosis. Diagnoses are required for treatment at hospitals, and there are different requirements for educationally based diagnoses for services such as IEPs. How do you best explain this to families, the hospital, the school? This is becoming a prevalent issue, especially with COVID-19. So yes, and that is something that I did see quite a bit. And so often this is like, if you do outside testing, school psychologists understand the language of the school and what is required in the school. And so often if you seek testing services with school psychologists, they can do that. But I'm a general psychologist. And so those psychologists can also help you navigate the world inside the school with IEPs and 504 plans and things like that. Some of them will offer to attend those meetings with you. Other times there are also kind of advocates who can kind of be a go-between. And then others will tailor their reports to meet the requirements of the school. Because yes, it is kind of tricky because the language of what's needed in a school setting is often a bit different from maybe what we would do in a private practice setting. Okay. Okay. So this question is a good one about, this is from a clinician who's in private practice, and often this one's about the gifted side. And I didn't talk about this, but let me go ahead and talk about it since I've got some time here. And I'm actually going to advance these slides while I talk about it so that you can see some of the resources that are available to you. So the gifted program, that is a program where students who are identified as having statistically significantly high IQ scores are able to get some specialized services and instruction and things like that. And the thing that's tricky about that is that there's largely a cutoff score. So you got to hit this score in order to be eligible. And that score looks different state to state. And so what this clinician was asking was, sometimes they go through a private practice clinician before going to request the testing program or the gifted program. And so I think that it's important, and they also asked about students of color, so Black students, and that sometimes it feels uncomfortable to seek services or testing in the school system because sometimes there are questions about, and we've seen that there are some differences in how scores kind of shake out based on racial ethnic groups, and that's a larger discussion. But I would say that it's still important to think about the student as a whole. And so kind of explaining to parents that we want your student to get the kind of resources, instruction, support that suits them. And so if a student truly would benefit from gifted services, we want them to have that. But then I've also seen where maybe the score was a little low and they maybe didn't qualify. And what's hard about that is that can be hard for the student and the parent, but it is far better for a student to thrive in a kind of a traditional environment, maybe with additional enrichment here or there or slightly tougher assignments, than to be thrown into a program that is so hard they feel like they're drowning. And when we're drowning, we don't thrive. And so we want to look at them as whole people. And so maybe having that conversation with those parents, and also as parents kind of thinking about what's going to best serve my student. Okay. So somebody shared that they have a Julie as a child, and there's a concern about that wait and see. And it's interesting because this reminds me of for those of you who are parents, when you think back to when you had your newborn, like any cough, any fever, it was like, oh my gosh, I'm going to the pediatrician. And they would often say, okay, after a while, like you need to wait and see. Like I was a frequent flyer at the pediatrician's office with my firstborn. And so I can understand that worry of, oh my gosh, you're telling me to wait and see, what if I miss something? So what I would say, if you've got a Julie, and to remind those of you who might have forgotten, Julie was the first grader who was still in the developmental range, but struggling a little bit. I would say that would be really, really good for tutoring and additional work, additional reading, finding games and things to make reading feel fun. So a lot more exposure in a non-evaluative way. Because the truth of the matter is, I have been in instances where the request was, kind of pushed through to, let's go ahead and do this testing. And where we ended up is, okay, we've done the testing, but we're still in a wait and see sort of situation, because developmentally, we're just not in a spot where there's enough signs to diagnose anything. So I would say continue support, enrichment, so that your student knows, hey, you're doing a good job, you're working really hard, and that's a positive thing, so that they don't fall behind and feel too frustrated. But yeah, I think that additional tutoring and things like that typically help. Okay. All right. So, and I'm going to go ahead and put on a disclaimer. Well, first of all, we've only got about 5 minutes or so left, but my disclaimer is that while I am kind of answering questions and providing some impressions, just know that I haven't gotten to sit down with you as parents or meet your students, and so I can only try to give you ideas about what paths to maybe seek, because your local professionals will really be able to walk you through what the next steps are. So somebody was asking about autism diagnosis. I can really only speak from the perspective of private practice setting and how those are evaluated, because those are pretty in-depth evaluations. That tends to go above and beyond what we would do for typical psychoeducational evaluation, because there are developmental pieces to it. So yes, diagnostically, in the field of psychology, we're going to use kind of our diagnostic manual in order to provide that information. However, the evaluation process is much more, is rather in-depth. And so I wouldn't be able to tell you if a school would actually do an autism spectrum evaluation in school, or if they're going to refer that out, because I do know from my experience in private practice that those are very large and carefully undertaken evaluations. And so I'm sure the time and scope that is available in schools varies. And so you'd have to kind of check in with them and seek out. Let's see. This is a great question. So somebody asked, and actually they've all been great questions. So somebody's asking, in a clinical setting where a student is tested on a one-time basis, is it ever explained to parents that it's important to see if a child responds to interventions within the school setting before diagnosing for a learning disability? Because that actually is in our diagnostic manual, that a student could be having trouble and there is it looks like a specific learning disability, but we do have a requirement to see, well, if we provided extra support, would that do anything to help alleviate their difficulty? So they talked about, bridging a gap between providers and schools. And so that's a really good point. I think it really depends on the setting and the clinician. A number of reports that I've seen and written have said we might have to, these are some impressions, and so maybe there's not a diagnosis, but we'd like to put forward these recommendations, and then they recommend a reevaluation in a few months. What's really tricky is, we want to provide, I think everybody does want to provide help and support to that student, and sometimes because of laws and requirements, it becomes we can only offer support if we have certain diagnoses, and so it becomes a really tough dance when we're trying to figure out how to ethically and appropriately diagnose, because you don't want to overdiagnose, but also trying to figure out how to get that student the help that they need. I'm going to actually kind of roll over to one other slide here that's got my contact information, because I think, oh my goodness, I might have gotten to all of the questions. So that never happens. So I think I got to everybody's question, but like I mentioned at the top of the presentation, there might have been some of you who felt a little maybe shy or uncomfortable about posting your question for us to discuss it here this evening live. So please do reach out to me. That is my email address there at the bottom, nrogers@parinc.com. It's my direct email. I read all of my emails and happily respond. So if you do have questions about just the process, please do feel free to reach out. And although I can't necessarily tell you exactly how your school district or your college is going to do it, I can, help to kind of dispel some maybe mystery about the testing process and help you learn, what should I be asking and who should I be asking? And so really that was our goal here this evening, to help you know a little bit more about what testing is, what to expect, and how to seek out tools and resources for your student, even if it doesn't end up being testing, but you do want to make sure that you take those steps and that you don't wait to ask questions. And hopefully this has made it a little less scary to do that. So thank you all so much for joining this evening, and I wish you and your students all the best.